Hello, and welcome to the Housing and Services Resource Center webinar for today. Today, our focus is addressing housing accessibility, cross-sector partnerships, a closer look at home modification collaborations at work. You are going to learn a lot from this session today, and I'm so glad you were able to join us. Next slide, please. My name is Sherry Clark, and I am an Aging and Services Program Specialist within the Administration on Aging, within the Administration for Community Living, which is a division within the U.S. Department of Health and Human Services. I'll serve as your facilitator for today's webinar. We're so thrilled. I keep watching the numbers growing and growing of people coming to the webinar, so I'm excited. We're so thrilled to have so many of you here today. And we know we're going to have a wonderful, engaging hour. Next slide, please. Because you know, many of over the past couple of years have learned all about technology and Zoom and these other platforms. There are always housekeeping items. So this meeting is being recorded. By staying to participate, you are consenting to the recording. Also, all attendees have been placed in mute to ensure that we have good audio quality. But please know that doesn't mean we don't want to hear from you, because we do. Please frequently use the chat feature to make comments and use the Q&A feature in the Zoom's app dashboard to ask questions. Or if you prefer, you can always send a question or comment to the Housing and Services Resource Center mailbox at hsrc@acl.hhs.gov. You can also use the chat or email feature if you're having technical issues or you have a comment for another attendee. Sometimes people have found the chat feature to be distracting. If that is the case for you, just close the chat screen. Next slide, please. We wanted to start off today to learn a little bit about who is joining us today. The work under the Housing and Services Resource Center, or HSRC, is designed to serve professionals in a variety of sectors. We'd like to get an idea who's joining us today. The poll that is displaying on the screen. The poll question is simple. What sector is your organization in? Are you a housing or homeless sector services, aging and disability networks, healthcare or public policy, community development or a civic organization, association, research, or advocacy organization, a consumer looking to find information for yourself, or other? So if you take the moment to complete that, that would be great. Next slide. While we're responding to the poll, I'd like to tell you a bit about the Housing and Services Resource Center, or HSRC. I'm about to get used to saying both just to be good, which stems from a partnership between the Administration for Community Living and other partner agencies within HHS and the U.S. Department of Housing and Urban Development. We know that in every state and community around the country, there are programs and entities that are working to access housing or support people with supportive services. But we also recognize that the housing and services systems are often siloed and may not work together. A lot of times it has to do with maybe we don't speak the same language or whatever, but sometimes that hinders the ability to better serve people. Stronger collaboration between these systems would enable more older adults, people with disabilities, and people experiencing homelessness to achieve housing stability, live with dignity and independence in their community, and avoid homelessness and needless institutional care, needless and costly institutional care. So people with disabilities and older adults can stay stably housed, healthy, and active. The Housing and Services Resource Center provides technical assistance across federal agencies to cultivate cross-sector partnerships that bring together housing, homeless services, aging and disability services, and an array of health issues like physical, behavioral, and mental health. After the webinar, I hope you will look at the Housing and Services Resource Center website, which is housed at acl.gov/housing and services. At the end of the webinar, we'll share an email address so you can keep in touch with us and get updates as new information is added to the website. Next slide, please. Now I'd like to take a look at looking at the poll results. Wow, we have a wide sector of people joining us today, and I'm so excited to see that. We have a good number of housing and aging and disability networks, but we also have good housers and people from a variety of sectors. This is so wonderful to know that there's a variety of people joining us today to bring different perspectives as we tackle this very important topic. Next slide. Today's webinar has been organized by the Housing and Services Resource Center, and we're making it available to you, one of ACL's longtime partners, the University of Southern California, Leonard Davis School of Gerontology. We have the privilege of starting this conversation with insights from USC. Then we will shift to a wonderful panel featuring successful state home modification partnerships. USC will lead the panel discussion in the Q&A portion of the webinar. I'd like to first introduce Dr. John Pinus, the UPS Foundation Professor of Gerontology, Policy, and Planning at the University of Southern California's Leonard Davis School of Gerontology, where he directs the Fall Prevention Center of Excellence. Dr. Pinus has spent his career researching, writing, and advising the government and private sector about how to improve housing and long-term care for older adults. He has written and edited 6 books. He been awarded the Guggenheim and Fulbright scholarships and was a delegate to 3 White House conferences on aging. He will be joined by Emily Neighbors, program manager of the Fall Prevention Center of Excellence at the University of Southern California Leonard Davis School of Gerontology. She conducts applied research and professional training in home modification to reduce falls and support aging in place. Emily co-facilitates the National Home Safety and Home Modification Work Group with the National Council on Aging. And a key aspect of her work is building and maintaining partnerships to promote home modifications. It is my pleasure now to turn the floor over to Dr. Pinus to really give us an overview of this important home modification topic. Dr. Pinus, thank you.
Thank you very much, Sherry. We've enjoyed working with you and ACL on a variety of projects. And I'm going to provide a brief overview and context of what's happening in the field and why it's so important. And we're happy that so many people have joined us for this webinar. We all know that more people are living in the community with disabilities, and more people are aging into the disabilities in the community. So 28% of households have at least one person who has difficulty using some element of the home. It could be climbing stairs, using the bathtub, cooking, getting outside, whole range of problems that the environment can present for older people. Taking a bath or a shower is among the most difficult for some people, and it's partly due to the environment itself. Next slide, please. So I refer to a lot of the housing we have as Peter Pan housing. It was not designed for people who are going to grow up and particularly grow old. Only 10% of our housing units have step-free entries, a first floor bedroom or bathroom, and at least one bathroom accessibility feature. If you look at the house on the picture, you can see that it's got a lot of stairs No other way to get into the house. And if you look very closely, you can see that the stairs are not marked in any manner. It does have a light over the door, which is helpful. But we're building housing, and especially older housing, where a lot of older people live, don't have the features that they need to carry out activities safely and easily. And in some way that hampers people from carrying out activities at all. These are especially problems for low-income people and the very old. Next slide, please. So home modifications is changing the home itself to make changes that work for people. There are a lot of strategies we could think of. One is to remove fall hazards, for example. If you go into a lot of homes, you see throw rugs, which are comfortable and but they're risky because they slide underneath you. Clutter is often a problem. Furniture can be a hazard if you can't see parts of it. There are very few houses that have anti-skid strips on stairs. So some behavioral things that could be changed often need the help of a relative or an outside professional, such as an occupational therapist or a case manager. We can add supports. A lot of homes are poorly lit. And some of it is due to lack of outlets for lights. Some of it is people trying to conserve energy because they don't want their bills to be higher. We can add support such as grab bars and handrails to a lot of homes. A shower seat or a bench can help. And we can try to change behavior. For example, moving items that people use often from high shelves to lower shelves where they can reach them. Getting people to sit rather than stand while preparing food if they don't have a lot of balance. And there are a lot of benefits to making these changes. One is to make daily activities easier, reduce falls and injuries. Importantly, to support caregivers, make it easier for someone who's living with an older person or someone who comes in. And we know from recent studies, these kind of changes can be cost effective and save money, which is all important to making a case for them to be paid for by the government. Next, please. Types of home modifications, there are many. Some are major. They call for large changes in the home. Some are minor. Sometimes people can make them themselves, like putting in a nightlight. Sometimes we need repairs in order to make changes. Assistive technology can sometimes help. And often in homes of people who are very frail, there's durable medical equipment as well. So if you look at the slide pictures on the right, you can see a walk-in shower. I put one of these in for my father-in-law when he came to live with us. He was very frail. I put in a handheld shower, grab bar, non-slip tile. And for all the years that he lived with us, he never fell in this place that was obviously could be very dangerous. You can change simple things like putting a grab bar next to a toilet. You can put in Lazy Susan type devices into shelves for people to easily access them. And you would think that these are all commonplace, but often people don't know where to turn for help. They don't know what kind of changes are possible and what the alternatives are. And they may not know how to access people who can come in to help them make choices about changes to make. Next slide. Next. I think we skipped one. Back one. Back another. I would say in summary, home modifications are very important. We need more education of older people and caregivers. We need better reimbursement. And as we'll talk about along the way, we need partnerships to make it work. So with that, I'm going to turn it over to my colleague, Emily, who's going to describe some other aspects.
Thank you, John. Next slide, please. So I'm going to focus on why partnerships are important in home modification. And while I'm talking, it would be great if you could please use the chat feature to tell us why partnerships are important to promoting home modifications in your community or state. We'd love to hear from you on that. Next slide. One big reason why partnerships are so critical in home modification it's because of the complexity of funding sources and the diversity of these funding sources. So on this slide, we are presenting a number of federal agencies that play a role in funding home modifications. This includes HUD, Centers for Medicare and Medicaid, Administration on Aging, the VA, Department of Agriculture, and Department of Energy. You can see that they cross sectors from housing sector, aging, disability, and healthcare. In addition to the variety of funding sources, each program comes with its own eligibility requirements. And these have to do with certain characteristics of each person. So are you a homeowner or a renter, veteran, for example? Also, levels of income, age requirements, having a disability, or even your geographic location can come into play in terms of whether or not an individual is eligible for home modifications. Next slide. Also, there's complexity in home modification service delivery. I'm showing here a diagram of the home modification process, and there are a number of steps. It's not just installation. There's intake, determining if someone's eligible, assessment, identifying an individual's home modification needs, setting priorities. You may not be able to accomplish all of the home modifications at once. What is most appropriate now, and then what could be saved for the future. Securing funding is also a big aspect. Then installing the work. And finally, follow-up is also critical to make sure that the home modifications are meeting the needs of the individual. Also, I would say, different professionals are involved in each one of these steps. Next slide. So this is an overview of the many different types of professionals that can play a role in home modification. And as you can see, it's quite a list here. I'm aware that everyone is going to have access to these slides, so I won't go into each item here, each individual, but it's just to show how many different types of practitioners should be at the table or could be at the table. Next slide. And we wanted to provide a more targeted diagram here of partners that you all could consider in your community or your state to expand the impact of services you're already providing, or help to connect individuals in programs that you have that may not include home modification and home assessment, working with these types of professionals to connect individuals to home assessments and home modifications. Next slide, please. Thank you. I would now like to introduce our home modification partnership panel. These are all individuals from Iowa who are doing amazing work in home modification. And we're going to hear from them and get some specifics of how partnerships can play a role in home modification. Kent Ohms is the Community Living Director at the Iowa Department on Aging. He oversees the Care Transition Initiative, Iowa Return to Community, and he works on strategies to strengthen and expand home modification services in the state. We'll also be hearing from Brenda Sherd. She's been active with Habitat for Humanity's work for more than 2 decades and currently serves as Director of Global Engagement, and she's a project leader at Greater Des Moines Habitat for Humanity. We're hearing also from Tracy Kenninger. She's a director at Easter Seals, Iowa, where she oversees several statewide programs for individuals with disabilities and their families, including the Assistive Technology Center. And we'll hear from Sherry McDonald. She currently works at Connections Area Agency on Aging, and she's worked in geriatrics for the past 30+ years. And I'm really excited to pass the presentation over to Kent Ohms from Iowa Department on Aging. He'll start by giving us a lay of the land of the projects in Iowa and what role partnerships play in Iowa Department on Aging, or IDA's, home modification service delivery. So thank you, Kent.
Yeah, thank you, Emily. So yeah, partnerships play a very important role. As Emily kind of highlighted, it's a very fragmented service delivery with lots of distinct professionals involved. In Iowa, it's much like any other state in the nation. Financial assistance kind of varies depending on where you live for housing related programs and factors such as do you own or rent. What programs you might be eligible for might vary depending on age requirements for older adults versus people with disabilities, if you're on Medicaid or not. Contractors are very difficult to find in the state right now, as a result of the kind of COVID-19 measures, remodeling and the building boom. We were competing with that. There was the 2020 derecho and other storm and flood recovery projects to compete with that people are trying to purchase. Prices of lumber and materials for large contractors, only looking for larger projects. And that kind of set the stage for the different partnerships that we were looking for and bringing together. Next slide, please. So one of the first projects we're just going to highlight today is the Community Aging in Place Advancing Better Living for Elders, or CAPABLE pilots that we have. This is an evidence-based program with approximately 10 visits from an occupational therapist, registered nurse, and skilled handy worker. We have 2 pilots going on in the state distinctly. One is in Western Iowa with Connections AAA. And they have hired people to serve as the occupational therapist and registered nurse, and then they contract with their local Habitat for Humanity and other skilled handy worker providers that they work with. Our other pilot project going on is in central Iowa, covering Polk and Dallas counties, where Des Moines is. And with that, we have Happy at Home Consulting providing the clinician services. We have Greater Des Moines Habitat covering low-income homeowners that meet their income guidelines, and we're braiding in their Rock the Block funding initiatives to cover those services. And then we're also contracting with other private contractors to deliver those modification services. Next slide. Also, some of the work we've been doing, we've been working with Easter Seals on some assistive technology and durable medical equipment initiatives. We got some funding through the coronavirus relief funds to accomplish this, and also had a little No Wrong Door grant funding for similar purposes. And consumers were able to access Easter Seals directly or with referrals from our 6 area agencies on aging. and they were able to provide about 90 consumers with about 359 assistive devices and durable medical equipment items, and they actually did a really great job. That was about 6 weeks that they had for that contract and did all of that work. And then next slide. And then just, I would be remiss if I didn't highlight some of the other partnerships and projects that we have going on in the state besides the people on the panel today as well. And, you know, our local AAAs help navigate people to these services and also provide some limited funding availability through the Older Americans Act and our state elderly services funds. But we have a smart home project going on up in Charles City, Iowa with Elderbridge Agency on Aging and Teltex. And they're kind of studying the usefulness and impact of smart home technologies and home environment monitoring systems on helping people stay in their homes. We have a AAA that's partnered with the city of Waterloo, and it was NEI 3A and the Iowa Heartland Habitat for Humanity that they're using community development block grant funds for this from the city and doing home modifications there. Also, you know, there were 2 spots in the state that had gotten the HUD Older Adult Home Modification Program grants that were new this past year up in the city of Dubuque and kind of the rural Dubuque areas for counties around there. And so we've made partnerships with them to connect the AAAs for referrals. And then finally, also, you know, just looking out there, there's the HUD Healthy Homes program that is also doing some home modification work. And there's kind of an array of entities working together there between city governments as appliers, county health departments, or nonprofits with those funds. And then just finally, as a starting point, you know, we have a Livable Homes Coalition in the state that kind of meets on a quarterly basis most of the year. And there's many partners here today that are on that and many more out there that represent consumer groups and advocacy organizations, business and professional groups related to this area and state agencies. And, you know, it kind of helps facilitate those introductions and partnerships. And they also have been advocating for a statewide program at the Iowa General Assembly as well. So I'll turn it over to you, Emily.
Great. Thank you so much for that context, Kent. Now I'll be posing some questions to our panelists to hear more. Tracy, I'll be starting with you. Could you tell us about Easter Seals Iowa's collaboration with the Iowa's Department on Aging related to home modification and assistive technology and how that collaboration started?
Absolutely, Emily. So, you know, Kent mentioned a bit about some of those opportunities that we had for funding most recently and to meet the assistive technology and durable medical equipment needs of Iowans. But really our partnership and connections started way before that time. And I think as many of you noted, as the state assistive technology program, we recognize these huge needs of which we clearly just did not have the capacity to meet, nor did we have the resources. And quite frankly, we did not have the expertise as well. And so it really started talking with Kent and his colleagues. They also shared the concern and starting the brainstorming process of how together we could really start to address some of these home modification and assistive technology needs in Iowa. And we really started, I would say, from a 3-pronged approach. One, looking at what Kent mentioned, more from the systemic and policy change with a Livable Homes Coalition, looking at what can we do systemically for policy and change, and then also really looking at working with Sherry and her colleagues with the AAAs and recognizing we can't do it all as a state AT program, but can we equip their staff with assistive technology kits that can enhance the usage in their populations of people that they're already serving. And the third area is we really now are all sitting on each other's advisory councils and committees and constantly looking for opportunities to coordinate and collaborate and not feeling like we're doing this alone, but really have a true partnership.
Excellent. Thank you. I'll move to Brendolyn. You also partner with IDA. Could you tell us about Greater Des Moines Habitat's work and how your partnership started?
Well, even though we're known at Habitat for Humanity for affordable home ownership, we actually in Central Iowa serve hundreds of families a year through affordable home repairs. And even though we do that, as the program has grown, nearly 4 in 10 of the people that we serve, or nearly 4 in 10 households among the people we serve, have somebody who is 65 or older. And many of these households have someone who self-identifies as disabled as well. And while we can do the ramps and the home modifications, we started asking ourselves, could we do more? More of these modifications, and also, were there things we might be missing because we don't have the right partners at the table? So we started exploring partnerships and thought that more intentional collaboration with health and human services providers would help us reach even more seniors and do it in a deeper way. We had a partnership that was getting started in Dallas County to launch a little capable pilot, and happened to mention it to the Iowa Department on Aging as we were networking. And they asked us to sign on to a grant application they had, and we're continuing to work together.
Wonderful. Thank you. And Sherry, let's loop you into the conversation. I know that we have some Centers for Independent Living on the webinar. Could you describe how Connections Area Agency on Aging has worked with CILs?
We have an excellent partnership with the CILs in our regions. And we started initially by just trying to train our staff on partner providers in the region. And so we had them come in and explain to us what they do, how we make referrals, what's appropriate referrals, what's not. And then we turned around and did the same thing for their staff. So as we met together, we started thinking, we're working with the same clientele, or the same needs are identified in our clientele and theirs. So that's where we started. And from there, we've just continued as we add different programs to see how each of us can meet the need. Sometimes we'll get a request for something that we can't fund or help with because they're under 60. So we turn to them and they can provide it. They've got a great loan closet. And so we utilize that as well for our individuals as well as the people that they serve. So it's been a good partnership for us.
Great. And could you describe how people enter your service systems or are identified as needing services and making those referral connections to each other?
Certainly. All they need to do is call one of the agencies that we partner with. So they can call into Connections, and we do an intake for our agency, and we look at what their service needs are. We'll assign an options counselor to go out and meet with them if they're open to that, and to do an assessment on their needs. And as far as I'm aware, the same thing happens with our CIL when the referrals come into them. And then as we look at the needs, we look at what we can do and the things that we can't meet or that we know we need to partner with, then we make that contact with the CIL and go from there. So we encourage the consumer to always be a part of this, but sometimes they're pretty overwhelmed, and it just takes someone else making a phone call to a provider for them to get the assistance.
Thank you. Tracy, what would you recommend as a first step to take to form partnerships to increase service delivery and access to home modification services for people with disabilities and for older adults? Yeah, what would be critical first steps? How do we even get started on this?
Yeah, as you might think, I would suggest reach out to your state assistive technology program, right? It's a great place to start. And then I remember countless conversations that Kent and his colleagues and I had. We didn't really have a solution. We didn't really know where we were going. We just knew there was a need. And we kept our focus on the needs of Iowans and trying to figure out the solution, not who's going to fund it, who's going to do what, but really focus on the needs of Iowans.
Excellent. And Brandolyn, are there any critical things to keep in mind when starting or working in partnerships?
I think the biggest thing is to keep communicating, to always be honest, and to work together on solutions, because when you try something new, it doesn't always work like everyone envisions it. But if you're collaborative and you still have the same goal in mind, you're going to find a way to make things happen.
And Kent, do you have anything to add?
Yeah, I had the exact similar thought. Always keep trying. You know, you might not get the grant that you were looking at, that you configured certain partners for, but something else is going to come around, and you might work with some other people and bring some previous ones along and create something new. And just always remember to reach out.
And Sherry, any ingredients for success in terms of building these partnerships?
I think, as the other partners have said, it's just reaching out to each other and becoming aware of what's available in the community for everybody. And that's been the biggest success for us.
And really briefly, I'd like to ask each one of you, I can start with you, Sherry. What accomplishments have partnerships allowed your organization to achieve that you wouldn't have been able to do otherwise?
Probably the first one that comes to mind is our first capable client, and it was a younger, elder person. He had just turned 60. He had a stroke about a year prior, and we got a referral to put him on our capable program. So with capable, there's a small amount of funds to look at what needs to be done. And this gentleman lived in the country. He had a farmhouse that he and his wife lived in. The garage was on a hill, the home was further down. There was no bathroom on the main floor. And so this guy had been a year following his stroke, doing therapy and everything else. And he hadn't been able to go to the bathroom. He had to use a commode. He had not been upstairs in his home. His wife, who had some health issues, was having to push him up a hill in a wheelchair. So a lot more needs than just one program could resolve. So we were able to tap into a caregiver program to provide some assistance with devices for his wife to help make things improve. We did a grant for the USDA for his stair lift, so he could actually get up the stairs, go upstairs, be able to utilize the bathroom, take a shower. And then we utilized capable funds to put a slab of cement down and a means for his wife to be able to get the car down on a level closer to the house so they could get in and out much easier in the weather. So it's just partnering and looking for everything that's out there in order to meet a need.
Thank you. And in the remaining minute, Brandolyn, could you also describe what accomplishments that partnerships have enabled your group to do?
Well, I think in general, it's besides the things that Habitat can do and does well, it's connecting those seniors to the other services they need to make it real. And also having a nurse and an OT in the home, working with the family, they're going to see things differently, because someone might tell our staff that they're great with, hey, grab bar is great. But it's the OT who can say, let's make sure you're using this correctly, because we can do the home modifications, but it takes other expertise to make sure people are really understand how to use them and are living a better life because of them.
Thank you. And Tracy, I guess we will end it with you and this section with you. What accomplishments have you all been able to reach with your partnerships?
I think I will answer that with an email that we received yesterday. It was an individual who has complex needs. who has some very unique circumstances. And the OT in this case sent out an email to all of us, and it was almost instantaneous where we were brainstorming, coming up with solutions. When we know each other and we have warm contacts, we can just move quicker and better on behalf of people's needs. And everybody was just on board to help in a very complex situation.
Thank you all so much for this information. And we're going to open it up to Q&A now from questions from the participants. And my partner, Molly French from US Aging, has been scouring the chat feature and Q&A box. So Molly, let's open it up to questions for our panelists, please.
Thank you, Emily, and what a wonderful panel. One of the questions that came in, hoping maybe a couple of panelists could address, is as you know, someone is seeing a lot of older adults and actually in their homeless population, and they're wondering, how, if there's a way to create partnerships to kind of extend these home modification partnerships to homeless service providers, and so that's the question.
Yeah, I'll jump in there. That's probably an area that we could expand and improve a little bit. We are engaged as a department on our state homelessness council. I'm not the person that's on that from our department, but we are represented there and engaging and trying to work with delivering the wraparound options counseling services and getting them connected to address their care needs. But that is a great idea.
Any other panelists?
We've done a little bit in terms of loaning equipment. So a homeless shelter might contact us, and we do work with the agencies that deal with a lot of homelessness in our region. So they do call us when there's a need for incontinent products or a shower bench because they've got someone that's in a shelter that needs that.
Thank you. Molly, any other questions?
Sure, there were just a lot of questions about funding. And so I thought we'd start first with Kent. And there was a question is if there was a single resource that you accessed to launch all this work. And
No.
then what were the kind of the core sources, just if you could recap that again.
Absolutely. And this pulls on my own prior background as a fiscal analyst. But yeah, there were many different funding streams available to us. We used the ACL falls prevention grants for empowering communities to launch Capable. And Brendolyn and Habitat for Humanity also brought in their Rock the Block funding to kind of braid with that in the service delivery of the overall project for matching funds. We used the coronavirus relief funds that was kind of in the first round of some of the funds that were given to states to use in discretionary ways for helping address that. The community development block grant kind of has two different prongs of funding streams. There's entitlement cities, which are usually larger cities above $50,000 that, a lot of cities have programs that will, kind of repair houses for people at certain income levels. And usually those repairs can generally address livability factors as well. So, if you do need a ramp or you do need some other adjustments to the house that might help with the person live there and stay there, that's usually a great resource. Within that same community development block grant, there's non-entitlement cities, which are usually for smaller cities across the state that usually one singular state agency has, that they might have a program that the cities would be eligible for. So, you would have to work with the AAA to identify the consumers, to build the relationship with the city, to apply to the state. But, it's there and it's possible. And, local housing trust funds are also out there and usually do a lot of low income home repair and home ownership initiatives. So that's kind of just top of the line.
Excellent. Any other panelists like to speak to that?
Well, I'll share
Scrounging.
more. Oh, sorry. Go ahead, Sherry.
I was just going to say, it really is scrounging everything you can. We've got a transition program with a hospital that is very open to helping to fund some things when we can't find other funding. We do use a lot of block grants for home repairs and ramps as well in several of our counties. So it's just looking for anything and everything out there.
Well, that's funny, Sherry. That's about the same thing that I was going to say. And a specific example of there was an individual that we were supporting who was older, who had assistive technology needs. And the AAA was able to provide some support to actually fund some housing modifications and some equipment. But we, through the assistive technology program, were able to provide some recycled and refurbished stair lifts, shower transfer benches to make the money go further. And then Habitat for Humanity was actually able to come in and do some of the home modification work. So by combining our resources and making the money go further, we were able to make a substantial impact on that person's life.
Excellent. Thank you. Molly, another question?
Yes. So one of the questions that came in was, how did the pandemic change the approach in Iowa to home modifications? Whether it was a change in the short term, or maybe it's a change that you did during the pandemic and that has evolved and maybe sustained.
I'd like to speak to that a little bit. The pandemic made it, I'll just say, really hard because there were people who needed services, but it's hard to assess a home if somebody doesn't want anybody in their home, because they're afraid of COVID. But, between masking up and getting out there, we were able to continue serving, just not as quickly as possible. There have been a lot of supply shortages and also cost increases, which make budgeting very difficult for a project. But again, sometimes it's been adapting. If this product that we normally use isn't in, is there another kind of product that would work? Things like that. And it also made, at least at Habitat, it made us really think about what kinds of parts of the process we could do more to automate. Slowing down in some areas made us put some resources and time that we knew we needed to into automating certain pieces of our process. And we're still working on that, but I think COVID gave us the kick to do even more to make it easier.
The other panelists before we have time for one more question. Okay.
All right. And there's one question that's actually better perhaps for USC, and which is, the person is looking for any type of, studies that have, or evaluations that have looked at return on investment in terms of home modifications.
That's a great question. There are many different outcomes that have been looked at in the research for home modifications in terms of reduced hospital readmissions, reduced skilled nursing facility admissions, cost to Medicare. I would say a great example, there are a number of articles about the Capable program out of Johns Hopkins University that demonstrate financial cost savings, saving healthcare dollars, in addition to excellent outcomes for the individuals in the program. And, I'd be happy to go more in depth, but yeah, a lot of outcomes include reducing falls, which have reduced dollars, reducing or increasing function, supporting caregivers. It's a little less common in the literature, but it's there. And then I recommend looking up the Capable program, and they have some great articles about their return on investment. And thank you so much, Molly, for navigating the chat and Q&A. We're going to share some resources that hopefully might answer some questions that we didn't get to. Next slide. We've worked very hard at the Leonard Davis School of Gerontology to create what we call the Home Modification Information Network. And it's an online database found on our website that includes listings of home modification programs, providers, and funding sources. And it's organized by state. So you click on a state and there's a lot of information on there. We work hard to keep it updated, but I encourage you to visit that page, webpage. Next slide. And our website, homemods.org, has a lot of other information and resources for consumers and professionals. We also have the Housing and Services Resource Center web address up here for a variety of resources about the intersections of health and housing. Next slide. And you heard a lot about partnerships with assistive technology programs, state assistive technology programs, and centers for independent living. And here are links for you to look up your state AT program and local centers for independent living in your state. Next slide. And aging agencies are also critical in these partnerships. You can find your state unit on aging and local area agencies on aging through the Elder Care Locator website, and which is operated by US Aging. And also you can find Title VI grantee programs. These are programs that provide aging services for older adults in tribal communities, and they're funded by the Older Americans Act. And we have a website here for that. Next slide. And here are all the presenters' email addresses if you'd like to follow up with any of the individual presenters. And I will go ahead and pass the presentation on to Sherry for some more important information before we close out. Thank you.
Well, I'm just excited. As Emily and Dr. Pinos know, that home modifications is such an important topic to me because I've seen the value of home modifications work in my own life to allow a loved one to remain in their home by making some simple modifications that we're able to do with a couple $100,000, not a couple $100,000, a couple $1,000. I didn't want you to think I was rich, but those kind of minor changes was able to allow me to continue to have a loved one in my home. And so that meant so much. I want to thank Emily and Dr. Panos for presenting on this importance of home modification and for finding a cutting edge collaboration. The Iowa folks have just been fabulous today. I want to express my deep appreciation for the Iowa Home Modifications Collaborative. Ken, Brendolyn, Tracy, and Sherry. I was just so moved by the way y'all are working together, but also the way that you all use and use various programs to bring things together in order to ensure that our individual is served. And that's really what this is all about. Before I close, I want to remind everyone that in the coming days, we will post a recording of this webinar and the slides to the Housing and Services Resource Center website. In the meantime, keep using the the website, which staff is providing in the chat. Next slide. But we're not finished. We want you to save the date. We recognize and appreciate that this topic is critical and so important. The Housing and Services Resource Team is excited to continue to partner with our colleagues at USC to offer a follow-up to today's webinar. We'll be offering an office hour on July 6th. Once again, we'll be featuring successful home modification collaborations and best practices, but in a format that enables participants to ask more questions and share their own innovations. Because I saw in the chat, there are innovations going on around the country. If you've registered for today's webinar, we will send you a notice about the office hour. Now I want to next slide, sorry. I gotta do next slide, sorry. I want to ask each of you to please take a minute or two to take a short feedback form survey. And you see the link on the screen. Staff is putting the link in the chat. There are just 5 questions asking you to rate different aspects about the work we're doing. If you have comments, you can provide them. Please know we read them, and today's webinar incorporated some points that were made to us after the last webinar. So feedback is important to us and we are paying attention. Next slide. The Housing and Services Resource Center is for you, is to ensure that at the federal level, that we're providing you what you need at state and local level to make a difference in someone's life. So please email us at hsrc@acl.hhs.gov for questions, suggestions, or tell us about your own partnerships so we can better share with the community. Next slide. And I can tell you none of this would happen unless there are these incredible people that were behind the scenes making this happen. I want to thank Mission Analytics. I want to thank US Aging. I want to thank Melissa, who has been wonderful. Thank you as our interpreter, and Serena, our CART specialist, for their roles in producing today's webinar. We talked about partnership. This Housing and Services Resource Center is about partnership. And we're especially grateful for everyone who joined us today. Thank you and have a great rest of your afternoon. Good afternoon. Thank you so much.